What exactly is minimal invasive surgery?
Minimally invasive surgery is a new technique, less incision, and recovery is very faster. Sometime very next day or in a couple of days, patient can be discharged. Recovery is faster, blood loss is less. There is minimal trauma during surgery. That is the main advantage of these kind of surgeries.
Is it fact many tumors reverse?
No, again the benign tumor if removed completely, so there are very less chances of their recurrence. But again malignant tumor or cancerous tumor, they can reappear. Despite giving radiotherapy and adjuvant therapy, they can reappear, malignant tumor.
What exactly is hydrocephalus?
Hydrocephalus is in broader term, like there is excessive water in the brain. Water means cerebrospinal fluid that's produced for 24/7 hours in the brain. So that is excessive due to some obstruction. That is, it causes enlargement of the ventricles in the brain. And that is hydrocephalus.
Can a mother transfer this tumor to the baby who is in her womb?
No, genetic it can happen because some syndromic things are there. That time it can happen. But these kind of tumor, if we see overall picture, these kind of tumors are very uncommon. Like mobile exposure to mobile, that actually has not been established in the literature. That mobile excessive use of mobile, it cause brain tumor. That has not been established.
Heard a word called awake surgery. Can you help us understand that?
Yeah, awake surgery, when tumor is located in room of error is very small. A small error can lead to weakness of one side of body, or it's located near to speech areas. So at that time we do awake craniotomies. Funny fact is brain itself is pain insensitive structure.
Oh.
While operating on brain, there is no pain. So it's only surrounding structures, dura mater, covering of brain, like where pain is felt. The patient is awake throughout the procedure. We do routine monitoring intraoperatively so that we can identify if there is any problem during surgery, any speech disturbance or weakness of one side of body. So that can be identified and that can be corrected, that can be rectified. So that is the biggest advantage. It's like real time. Patient is awake throughout the procedure. They keep talking, keep singing, and we keep monitoring. It's real time monitoring actually.
Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr. Anil Sharma, who is a leading neurosurgeon working with AIMS, Raipur. Namaskar sir. Today we will be discussing about minimal invasive surgery with Dr. Anil. Sir, we would like to know what exactly is minimal invasive surgery?
Minimally invasive surgery is a new technique where we put less incision. That size of incision is very less and recovery is very faster. The blood loss is minimal in these kind of surgeries, and sometime very next day or in a couple of days patient can be discharged. That's and recovery is faster, blood loss is less, and there is minimal trauma during surgery to the surrounding structures particularly. So that is the main advantage of these kind of surgeries.
Sir, how is it different from the traditional form of brain surgery?
In traditional surgery, there is long incision, operative time is longer, and there is while dissecting, while operating, and there is trauma to surrounding structures, bleeding is more, and a problem of scars. So main advantages in these kind of minimally invasive, whether it's brain or spine, that scar is less and recovery time is very fast in these kind of surgeries.
Like, are there any specific problems which can be treated with minimal invasive surgeries, or can we use it for overall any kind of surgery?
Yeah, in brain we do endoscopic, like for pituitary and anterior skull base tumors, we do endoscopic, and practically there is no scar. We operate through the natural corridor by the nose, so there is no incision in that. So for pituitary and anterior skull base tumors, and for brain tumors also, it's not applicable to all kind of tumors, but it's applicable to anterior skull base and pituitary surgeries and intraventricular tumors, where with a small incision the tumor can be operated. And in spine particularly, for degenerative diseases, for tumors, so we operate through very small incisions, and operative time is faster, bleeding is very minimized to a great extent, and patient recovery time is very fast. So patient can resume duties in couple of days.
In traditional method, if somebody is going for a surgery, brain tumor surgery, then normally what is the span of recovery, and how is it different from the one done through
No,
minimal
that depends
invasive?
on variety of factors. It's multifactorial, like for what we are operating, what kind of disease we are treating upon. But in general, because there is long incision, operative time is also long, blood loss is more during open surgeries. So that it's multifactorial. It cannot be dictated by single factor. It's multifactorial.
But in general, we can say that the recovery is faster in case of minimal invasive.
Yeah, recovery is faster. Recovery is faster, and minimum pain because we are not dissecting around surrounding structures. There is minimal trauma to surrounding structures, adjacent structures.
So can we deduce that this is a safer method?
Yeah, it's safer. It's safer method.
In terms of any traditional
Yes,
method?
it's safer.
Okay. Sir, what if is there any age restriction for this kind
No,
of
as
surgeries?
such there is no age restriction. As such there is we have operated in a child also minimally invasive surgery for intraventricular tumors or spine tumors. So as such there is no age restriction. But again, like all kind of tumors, that it's not applicable to all kind of tumors. We have to select the cases. We have to select the cases.
So then all tumors cannot be
Yeah, all
like
tumors,
operated
all
through?
tumors cannot be operated.
Like sir, like how helpful is it to like this kind of surgeries, like in slip discs and other?
In slip disc, again trauma is minimized. So very next day patient can be discharged, or sometime even on same day we can discharge the patient in minimally invasive surgery. So there is incision is very small, and a millimeter incision will be there, and very next day patient can be discharged, and it's pain free, and that mobility same day we can mobilize the patient, and very next day can be discharged.
Sir, are there any after effects of this kind of surgery?
No, there is no after.
So most of the cases then we can deduce that this is 100% successful surgery, right?
Yes. But again, that selection of cases, that is important.
Right.
Selection of cases.
So post operation, this kind of patients who went through these surgeries, invasive surgeries, then their hospitalization period is shortened?
Yeah, hospitalization period is shortened. That recovery time is also faster, and that overall that burden that is reduced, and in very short span of time they can resume their duties. That's the biggest advantage. That overall that burden that is reduced.
Sir, we would like to speak to you something about brain tumors also here. Like as you mentioned, there are many kind of tumors. So can we just highlight on the special kind of tumors which are a bit difficult to handle and which are dangerous?
Yeah, brain tumor, there are certain myths about brain tumor. First is like it's very deadly, and like it's become very scary, like brain tumor, now there is no hope. So it's not like that.
Right.
So there are two kind of tumor. One is primary, that originates in the brain or adjacent structures, and other one is secondary. That means primary origin is somewhere else in the body, maybe in liver, lung, kidney, and then from there they come to the brain.
Okay.
So most of the primary tumors, secondary tumor by nature itself, they are malignant. Malignant means cancerous tumor. Primary tumor can be cancerous or non-cancerous. So most of the non-cancerous or benign tumor, that can be managed very well. Once tumor is resected completely, and the patient is cured for whole life. Patient is cured for whole life. But again, that metastasis or malignant tumor, that cancerous tumor, so for there, after surgery, we need to do radiotherapy and adjuvant therapy also. These are the basic, but there are many, this is the broad classification, but there are many varieties of the tumor. But we have to understand that majority of these tumors can be managed very well. And that timely presentation, that's very important. Because I've seen many patients who has come like blind completely, and they could have been treated very well with good outcome had they presented on time. So it's very important, timely presentation.
So like awareness should be
is very
like
important.
when exactly to reach out?
When exactly to reach, and we need to identify symptoms also, because sometimes these symptoms can be non-specific. Early morning headache, particularly associated with vomiting, and blurring of vision, and hearing problem, balance problem, weakness in some part of body. So these factors we need to see, and we again we need to understand that majority of these symptoms are non-specific and not due to brain tumor.
Okay.
But if there is any new symptoms, so we need to see that new symptom
Sir,
we need to
how can
identify.
somebody differentiate between the
No,
symptoms?
suppose the persistent headache, particularly early morning time, associated with vomiting, blurring of vision. So these features we need to see, because brain controls everything.
Right.
Everything is in body is controlled by brain.
Right.
And symptoms of that particular tumor is dictated by the location and surrounding structures, like from where tumor is arising. So suppose it's near to that visual apparatus, patient will present with vision loss. It's in nearly that organ where balance is managed, so it will present with imbalance while walking or hearing problem. So that is dictated by the location of the tumor.
So whenever such kind of a person, an individual complaining about these problems or these symptoms which you mentioned reaches you, so what is the first step a
No,
neurosurgeon or neurologist
first we
takes?
do detailed neurological evaluation. We identify and we make a clinical diagnosis, and then we need to do for CT scan or MRI scan for confirmation, and then accordingly what are the findings, then we proceed for further management.
Sir, is it a fact that many tumors reverse?
No, again that benign tumor if removed completely, so there are very less chances of their recurrence. But again malignant tumor or cancerous tumor, they can reappear. Despite giving radiotherapy and adjuvant therapy, they can reappear, malignant tumor.
Sir, what exactly is hydrocephalus?
Hydrocephalus is in broader term, like there is excessive uh, water in the brain. Water means cerebrospinal fluid that's produced for 24 into 7 hours in the brain. So that is excessive due to some obstruction. That is, it causes enlargement of the ventricles in the brain, and that is hydrocephalus.
Sir, are there any specific reasons because of which this happens?
It can be due to the basic pathology is obstruction, but it can be due to tumors also. It can be due to infections also. So it can be congenital also. So there are variety. It's multifactorial.
How is that diagnosed?
It's diagnosed like in children particularly. There is enlargement of head, and there is delaying in milestone and enlargement of head, delayed decrease in the activities. So these are the symptoms, and then we do scans, and then we diagnose the hydrocephalus.
Like, is minimum invasive surgery possible in case of hydrocephalus? Do we have any options?
Yes, we have that is called endoscopic third ventriculostomy, and we put a small hole in the brain, and by endoscope we reach the ventricle, and then we make a opening for that free flow of CSF inside the ventricles. So, like patient is free of hardware, that BP shunt is not required. Otherwise, that BP shunt is chances of obstruction and chances of infections. That's very high in ventriculoperitoneal shunt that we put from a brain to abdomen. So chances of infections are very high. So by doing ETV, that minimally invasive technique, so patient is free of hardware. That is the biggest advantage.
Sir, can like children undergo this?
Yes, yes. So usually it's avoided in below 6 months, because that absorption capacity is not that much. But after 6 months, it can be done. It can be done.
So it's a safer option.
Yeah,
as
it's
you
a safer
mentioned.
option. It's safer option.
Right. Sir, like this kind of shuntings, like whenever we have seen in BP shunt also, post once a patient has recovered, the shunt is removed. In this case, what is the procedure?
No, that is natural corridor. Actually, we have done fenestration in the floor of third ventricle.
Okay.
So there is that is naturally that is being circulated inside the brain.
Okay.
So there is no need to do anything. No need to do anything after that.
And it's completely safe
Yeah,
when it's in the body
safe.
of the
It's
patient.
completely safe. Yeah, it is good outcome also. The success rate is very high. Depending upon what kind of patient and pathology we are choosing, the success rate is very high as compared to BP shunt.
Okay. Sir, like the post-op checkups, Like what is the duration of that? Like a patient undergo this kind of surgery, like how frequent he or she has to visit a surgeon post?
No, usually after CSF diversion, whatever we are doing, BP shunt or ATV,
Yeah.
that patient improve actually immediately after surgery.
Okay.
They report improvement in the symptoms.
Mm-hmm.
But usually, usual follow-up for after endoscopic third ventriculostomy, usual follow-up is after once the patient is discharged and stitch removal. Usual follow-up is at 3 months. And 3 months we get a scan, we get a MRI scan done, and we compare from preoperative scan that how ventricle size has been, how much ventricle size has been reduced. So that we do it the follow-up.
Sir, in any way, does this reduce the lifespan of any person who is on a shunt?
No, this is a fairly safe procedure. It's fairly safe procedure.
Great.
And in fact, it is that CSF diversion is one of the most common procedure who has saved more number of human lives in the history of human mankind. CSF diversion.
Okay. We can conclude that if this is diagnosed and in place, then we can assure a better life,
Yes,
a normal life for these
Yes,
kind
yes,
of
yes.
individuals.
Yes.
Right. Sir, I wanted to know how helpful is minimal invasive surgery in case of a slip disc?
Yeah. So slip disc is actually very common. It's very common nowadays. And, things are again due to variety of factors like prolonged sitting and overweight, prolonged sitting, and we are not moving frequently. We are not taking care of the spine. So these are sedentary lifestyle. So these are very important factor. But good thing is that majority of these slip disc can be managed without surgery. Almost most of the time, more than 90% of the time, these discs can be managed without surgery. So only thing we need to do physical rehabilitation, physiotherapy, and exercise. Only thing we need to do, and with some medications. But having said so, whenever it's required, it can be operated with minimally invasive technique. So very some millimeter incision, and the disc can be removed by that incision. And very same day, patient can walk. Very same day, on the day of surgery.
On the very day of
surgery. And next, the patient is discharged most of the time.
Okay.
It's very, and they get significant relief after these kind of procedures, minimally invasive procedures.
Sir, I would like to know what is exactly the pain management procedure post these kind of surgeries?
No, usually like disc happen because there is some sort of compression over the nerve root. The disc is causing some impingement of the nerve root. That is the basic pathology. So when the disc is removed, so mostly after surgery, they report significant relief in their pain and low back pain or radiating pain. They report significant relief after surgery. So most of the time, if that pathology is tackled, that they will be pain free after that.
Sir, broadly causes क्या होते हैं brain tumors के?
Most of the time, it's difficult to identify the cause, and we cannot determine the cause most of the time. But it's multifactorial, and it can be genetic, it can be related to syndrome, and it can be familial. But these kind of tumors are very rare, and sometimes it's linked to radiation exposure and some occupational exposure. But most of the time, it's indeterminate. We cannot identify the cause of tumor.
Sir, one very important question can a mother transfer this tumor to the baby who is in her womb?
No, genetic it can happen because some syndromic things are there. That time it can happen. But these kind of tumor, if we see overall picture, these kind of tumors are very uncommon. And mobile exposure to mobile, that actually has not been established in the literature. That excessive use of mobile, it cause brain tumor, and that has not been established.
Okay.
But again, having said so, we should be cautious for excessive use of mobile.
I would like to know on a basic term, now in layman's language, I would say that obviously we would not be able to judge all the signs in terms of a tumor as such. But there should be some specific symptoms which can be, demarcated from the other symptoms, and a person can feel that this is the time I need to reach out to a doctor?
Again, like as we discussed earlier, if there is early morning headache that awakens the patient in the morning, early morning, and particularly when associated with vomiting, difficulty in seeing objects, blurring of vision, and if it's associated with the hearing loss, if it's associated with imbalance while walking, if it's associated with weakness in some part of body. So these kind of symptoms, if these symptoms are persistent, then we need to seek consultation with neurosurgeon.
Aren't few of these which you said are symptoms of vertigo as well?
Yeah, vertigo, that can be due to variety of factors, but brain tumor is also one cause of that. But again, as I said earlier, many of these symptoms are non-specific, and that can happen due to variety of factors, other factors also. So most of the time, these features are not due to tumor,
Right.
brain tumor, but we need to identify that cause. That's very important. Because again, one thing I would like to highlight, because as there is, like we cannot prevent brain tumor most of the time. So the only thing which can help us in early identification and proper management, early management. That is the most important thing.
Right. Sir, a person who has undergone a tumor surgery, like post surgery, should they follow a proper lifestyle or any specific routine which they need to follow so as to remain healthy and to avoid recurrence of these things?
Yeah, as such that lifestyle, that is okay. That generally we need to take care of all those things. But once tumor is resected completely, as we discussed earlier, if it's benign tumor and tumor is resected completely, so patient is free and cured of the disease for his whole life. But again, we need to check, we need to follow patient for any recurrence. And for malignant tumor, once tumor is resected, then we need to give radiotherapy and adjuvant therapy for that. And we need to follow patient every 3 months or 6 months. That's very important for early identification of recurrence in malignant cases.
Routine checkups.
Routine checkup. That's very important.
Right. Sir, of late we have actually heard a word called awake surgery. Can you help us understand that?
Yeah, awake surgery, when tumor is located in very vicinity of it's near to motor cortex, like where the room of error is very small. A small error can lead to weakness of one side of body, or it's located near to speech areas. So at that time we do awake craniotomies. So funny fact is, brain itself is pain insensitive structure.
Oh.
While operating on brain, there is no pain.
Okay.
There is no pain. So it's only surrounding structures, dura mater, covering of brain, like where pain is felt.
Okay.
So the patient is awake throughout the procedure, and we do routine monitoring intraoperatively so that we can identify if there is any problem during surgery, there any speech disturbance or weakness of one side of body. So that can be identified and that can be corrected, that can be rectified. So that is the biggest advantage. It's like real time. Patient is awake throughout the procedure. They keep talking, keep singing, and we keep monitoring. And it's real time monitoring actually. So side effect or weakness or neuro deficit, that can be identified early. That's the biggest advantage.
Okay. So, are there any special kind of equipments which you people use?
No routine. It's a routine instrument only. But we do use like neuro navigation. That is like something similar to GPS.
Okay.
Neuro navigation, neuro monitoring we use, and we have all like latest microscope, endoscope whenever required. That's one important tool, endoscope, and latest microscope, neuro monitoring, neuro navigation, ultrasound. So these are the routine equipment that is used during surgery.
As you mentioned, the patient is awake throughout this process. Behave abnormally in this case?
No, usually that does not happen because already we counsel them, and there are certain criteria to fulfill. Like when we are planning to do awake craniotomy, there are certain criteria that we need to follow. So it's not like in each and every patient we are doing. Particularly when patient is otherwise fit for awake surgery, and tumor is located in vicinity of speech area and motor cortex area, then only it's required. Usually this does not happen.
So, any specific age group who are like more susceptible, or maybe they can follow this procedure?
Very young
better?
age, children, it's not possible, but
Okay.
otherwise there is no problem.
So, last but not least, we would like you to give a message to all the patients across, and even to the normal people out there, that minimal invasive surgery, how productive it is and how useful it is as such.
So first, we need to approach early. That's very important. We need to identify symptoms, and that earlier we reach, that is the biggest step that we can take. Because what I see here, like patient often present very late. By the time they are reaching that, already that deficit, so they are suffering from severe deficits. So that outcome may not be that good. That's very important. As I said earlier, like many patients, they are coming like while at complete blindness, they are coming with complete blindness. So had they come early, that outcome would have been much better. So that is the problem. And as far as minimally invasive surgery is concerned, that is cosmetically appealing, and scar is very minimal, and the recovery time is very less. That's very important. The idea of minimally invasive surgery is not only to do like a small incision. That is the least part of that. Idea is not only small incision. Like it's similar to like how abdominal surgery has been transformed by laparoscopic surgeries.
Right.
It's similar to that.
Okay.
So in very less time, with better recovery, that can be done.
So, from this entire discussion, sir, can we place it like post minimal invasive surgeries? If we are following a proper physiotherapy regime, then particular individual or the patient can be benefited?
Yeah, rehabilitation is very important part of that. Rehabilitation, after all, like for cognition, for neuropsychiatry support, apart from physical rehabilitation, that neuropsychiatry support, that is also very important. That's very much important.
Thank you so much for giving us such beautiful piece of information. And going further, I'm sure with this kind of awareness, people will be more, they will be more interested in going for these kind of surgeries without any fear in their mind. So, thank you so much.